Thank you very much to invite me to this conference. But I'm not a dietitian. I am a doctor, and now I am working in healthcare management. And I would like to talk about other perspectives of the role of openEHR in the use of data. Because in the technical perspective, I am completely agree with the previous speaker, complete. This is, for me, a very good news that this approach is now a mainstream. I have, with this standard, more than 25 years of experience. I learned in the European project in the good electronic health record. This many years ago. I know the European standard and openEHR, and I am very frustrated many years about the role of this standard in regional, national, and European projects. And now, I understand we are a new time, because I debate many times with technical people what is the key question of this chain, and I think the first is data. It's frustrating for clinicians because the real force to use the standard have to be care of patients. But really, it's not in these 25 years we can see the use of this standard for the patient care. And now we have a new opportunity to use the authentic role of the advanced standard for the role of data in our society. This is our experience. Like, I work in 12 de Octubre. Many of the slides and the data of the experience is of the hospital 12 de Octubre and the Infobanco experience. But I would like to try here, because it's a common experience of many people in this room. Pilot project, more big project, and now the opportunity to make regional, national, and European projects in a big scale. Our experience was hospital experience in a region, Madrid region, but really is 500,000 people experience. Now we are talking with my new experience in a region, a little region in Spain, is Cantabria, is 500,000 people, like in the October, but with a different, this as autonomous region, and we have now a debate about governance. What is the role of each part in that data use for the governance? And I would like only say one message for all the role of openEHR, not only in the technical aspect, the role in the governance of all the data space, the data use, the data meaning. Really, I know, I believe that openEHR is an opportunity to use in many of the present challenge. Of course, fill the gap between primary use and secondary use. It's perhaps the only solution, real solution to fill the gap. But not only, this is a common language between care of patient and all the secondary use. Of course, healthcare, learning system, knowledge generation, or public health. And this is my message for the presentation. But this is the experience in the Hospital 12 de Octubre with the Infobanco. It's very similar like the previous experience, because many previous projects about use of data only take one road, the use of a standard with the more detail of context of the primary care data. And one concept about in the local environment and hospital, primary care or hospital, a local provider, is what is the cyclical process of primary use and secondary use, because this is the virtuous cycle. We haven't take quality of data. We don't engage the clinician in this, in the define of the primary use, and we need a semantic, not only a semantic, a contract between the data entry and the data use with all the actors in the community, in the healthcare community. And this is many years ago with Deepak Kalra, a common reflection about we can use this like a improvement cycle, permanent improvement cycle. And other paradigm, only one data entry, like this is for clinicians like me or for all the healthcare management, we need use this paradigm like the only negotiation with any kind of technical solution. And this is for our clinician or for any other actors in the health data ecosystem, the first paradigms. Only one data entry, and only one model for data entry, enough to recover all the context of the health data entry. openEHR, I agree with the previous presentation. And we have other important question. We have to demonstrate that it is possible and this is useful. And we have many experience in this project, in this kind of project in Madrid region about the methodology, and more important, the use of all the standard in agnostic approach. And the key question, how can this approach use in the strategic use case? This is one collect of paper of the European Union, and to show that in all these strategies, we need one common standard for use of data. We have only openEHR or European standard ISO 30909. And all in any of these use cases, we have one relevant experience about we can use the same data model to multiple purposes. For example, to use this data in the research, in clinical trials, in the pandemic. Of course, the pandemic was the crisis of the previous model. We can demonstrate in weeks we have data about COVID in real practice because we have previous data common data models in openEHR and other terminologies. And of course, we can exchange data with any kind of project, OMOG project, I2B2 project, because we can use mapping and any kind of technical artifacts to transfer the data. It's not really a problem about the technology. It's more a problem and a common approach. Of course, we have understand that in the health system we need data not only for research, we need data for value-based healthcare and any kind of paradigm about the healthcare, learning healthcare system. And of course, the new approach about the use of phenotype data with genotype data to association. And we have common models in phenotype and in variant of the genomic info in the standard. And of course, in the new approach of learning algorithms to support the decision to clinician. And this is my previous experience in Madrid. But now my role is in a ministry, in a regional ministry, in healthcare, manage of regional healthcare service. And we have only 500,000 of people. We have one advantage. We have In this region, near and only one provider is not only a public provider for all the people. We haven't a private provider or only kind because for this we have all the data of this population, and we are not more big. The hospital and a strong network of primary care, and we have one regional health institute, and we have a regional ministry. We have in a little region all the actors in the same building. Why speak about this? Because I think one of the biggest problems is meet all the actors in the same building and discuss about the primary and the secondary use in the same table. And in Cantabria, we have the opportunity for our sites, for our culture, to work to prove how can agree and governance all these actors in the new health data space. Because we have in the region opportunities, but of course we have challenges and we have conflicts, of course. So it's not only the opportunities. We have the same problem. Who is the owner of the data? Who can use, what is the flow between users and providers? But more important than this, in this moment, is really we haven't the same meaning in all the system. And we have only one model to combine all the data for the different orient and the different purpose. And in this discuss, we would like explain our approach. I understand we can use openEHR to fill the gap between the primary use and the secondary use. And this is the primary key to the governance of the medium in the electronic health records, and like in the previous presentation, in the case report forms, RESCAP, or in RESCAP in our research institute for the research project. In our project now, in our use case, we now use one big case report form because we have one prospective cohort, genomic and phenotype association cohort, 5,100 people in a prospective genomic cohort. And we want to confluent the genomic and the healthcare data for this population in the regional data space. And the challenge is how can do a common meaning with this research and this healthcare data. And we want to use openEHR for this purpose. This is one strategy for to think about this, the use of openEHR in this role. And this is a learning of the Infobanco. And to understand, we have 4 levels of governance in this kind of project, in a regional project and in a national project of the data. At different areas of governance, each area, primary use, the data owner, the healthcare service, or secondary, for secondary use, obviously the access point or access board but the most important, we now construct one meaning committee, meaning board for primary use and secondary use for healthcare and for research and public health. The technical is very similar to Infobanco. This is the same slide of Infobanco. We change for the funding and the architecture of the contract of the regional project. But I would like to show this reflection in our new team in Valdata it's a pedagogical to understand the quantity of data in the primary use and the secondary use. Fourth, in the perspective of user, because this to show we are healthcare the origin of data, but not the only user. And this is important to, in this table, to drive the negotiation between all the parts. Really, we have reviewed the literature and we have data, real data, about what is the percentage of data for origin. This is an approach with inference about other literature, about cost, about other use of data, but not really this data is real source. It's a challenge to investigate about if we have one region with all the patients. This is an approach, but this is the origin in the electronic health record, the case report for research, or other kind of data origin for public health. And in the other hand, is who is the user of the data? And this is the chain of proportion. Of course, there are other secondary use for the healthcare system. Not only generate evidence, it's other, that is the healthcare, the learning healthcare system. The use of data, not for generate validate evidence, is only for the improvement of the system, of the health system. And this is the other proportion of the use of data. And in this project, with European funding, we have four use cases, four I prefer name demonstration. One about the role of openEHR to feed the gap. Second, how can use openEHR to combine in the repository the originally epidemiologic case report for of Corte Cantabria, the genomic court, in the common repository for all the region, not only healthcare repository, research repository like the European directive said, and other use case for public health and for the learning healthcare system. And in conclusion, we have many challenges for the use of data, health data in Europe, but now I would say only a message. For the governance, openEHR is a central tool, not only for the meaning or only more technical, like previous speakers said, but for governance, openEHR now is important for manage, for researchers, and for public health. Thank you.